So our next speaker is Dr. Tiago Costa, and he's going to tell us about his intervention. Dr. Costa.
Thank you very much for this opportunity to speak a little about this project that was developed in the Azores archipelago, Portugal, namely in São Miguel Island. So to give you a little background information, in Portugal, pharmaceuticals are sold in the community pharmacy in predefined packages. So it's not like a unit dose system. So a patient will buy always what the size of the package that the industry has to sell. In this way, the local hospital, the only one in the island, opened a public sales unit with the unit dose dispensing system to sell pharmaceuticals, not only antibiotics, to in-house patients who have been discharged, and also patients that came from the emergency room. So patients who went to this public sales unit to have their prescriptions filled out, pharmacists and pharmacy technicians analyzed the prescriptions, and after validation, we gave the number of pharmaceuticals that were in agreement with those regimen prescribed by the physician. For that, we used the predefined packages, but we reconditioned it in new packages, in secondary packaging, with the necessary pharmaceutical units for the completion of the treatment. So in this matter, pharmacists, myself, during 1 year, took out all the information that all the prescriptions that arrived in the public sales unit, and took all the information about antibiotics, namely the number of prescriptions of antibiotics and the number of pharmaceutical units that were not dispensed to the patients. All this information was put in a digital database that was Excel, and afterwards, after we analyzed the results, we have achieved the following result: that we made 663 interventions, pharmaceutical interventions, that gave 3,939 pharmaceutical units, corresponding to 1,032.99 euros. Afterwards, we took all of this information and we used the National Institute of Statistics of Portugal with some data, and we extrapolated to a national level, and we found out that there could be a potential of savings in pharmaceutical regarding antibiotics that could achieve 1,444,317 pharmaceutical units, and could reach €500,000 in savings. So what were the main learnings in this study? It was that the unit dose system can provide socioeconomic benefits for healthcare systems, and also prevent AMR because we stopped some pharmaceutical units of antibiotics to reach out the house of patients. That publications say that they dispose them in garbage in the environment. Sometimes they give them to their friends, and this is a public health situation. Also, this taught us that package sizes made by the industry need to be assessed to comply with the dose regimen prescribed by physicians, because we saw that namely in the urinary anti-infectives and the antiseptics, aminopenicillins and penicillins and bacta-lactamase inhibitors combinations, they achieved the higher number of savings. Afterwards, I think governments, and my colleagues think that governments should implement specific rules and legislation in the antibiotic dispensing circuit in pharmacies, in community pharmacies. Maybe it's time in pharmacies to create a special circuit like narcotics, not exactly, but in unit dose system, because there are few antibiotics in the market, and perhaps we need to dispense it in a unit dose system. And in hospitals, we can provide to in-house patients who were discharged with the necessary amount to complete the treatment at ambulatory care. Finally, I would like to say this study is published also in scientific in a scientific article. So if you want to see more, the link is in the end.
Thank you very much for those brilliant presentations of these 3 cases presentations. So now I will invite all the presents to submit the questions that have of
so much your project, especially for the economic evaluation that you has carried out. I think it's very interesting, this kind of results. So I wanted to ask you what the next steps in this initiative will be, in your opinion, and if you have considered transferring these results to the involved stakeholders, such as the pharmaceutical industry or the policymakers. Thank you.
Well, thank you for your question. In fact, I have shared a little bit this work with several institutions because I think it's very interesting, and to make awareness about this problematic that people are getting a lot of leftover antibiotic leftovers at home, and articles say that they are using them in a subtherapeutic level. They are harming the environment by throwing them out. So yeah, I've shared this with a lot of entities in Portugal, international, but until now I didn't get any answer. And I think it's difficult because there is an industry lobby, and it's difficult for pharmacies here in Portugal also to implement a unit dose system. It could be in terms of antibiotic only, because they need to do several adaptations, and yeah. But in fact, I have contacted legislators about this situation, but until now, no answer at all.
Okay. Okay, thank you, Tiago. Congratulations. And I